From my heart, I pour it out to you. I am here.
Good morning, everyone. Greetings on World Homeopathy Day and gratitude to our master, Dr. Samuel Hahnemann. On today's occasion, I will share one interesting case with you all guys. A case is of a catatonia. Myself, Dr. Vivek Vasoya. I am a homeopathic psychiatrist practicing at Rajkot. I will introduce about catatonia. Catatonia is an behavioral condition that causes an abnormal posturing and movements. It is usually associated with mood disorders, schizophrenia, and other medical and neurological conditions. Acute medical and neurological condition as well as drug withdrawal and toxic drug state can trigger catatonia. According to current data, it occurs at presenting complaint in 7 to 15% of acute psychiatric inpatients. The awareness of catatonia among general medical doctors and even psychiatrists is lacking. A catatonia is often missed while diagnosing. If diagnosis is not done on the time, risk of morbidity increases and leads to fatal outcome. The very nature of catatonia make it challenging. It is difficult to carry out patient interview and physical and mental status examination, thereby interfering with the recognition of underlying diagnosis. So it is very important to recognize the symptoms and syndrome early and quickly initiating the treatment. We'll go to the case. A case of 26-year male, occupation online business, education graduation, no prior history of psychiatric illness, family history of acute episode of psychosis in the father. Sister, who is homeopath but general practitioner, referred the patient. Boy having a lean, thin body, British complexion and beard, brought to my clinic by father. On observation, patient was just staring the wall with minimal body movements, not blinking his eyes, not answering any questions, no eye contact. I tried to ask some question with calling him by his name, but he did not respond. It looks like he did not hearing any words. Hence, I decided to inquire from the father. Father said that his state is from 3 days. He is not taking care of self, not sleeping, not eating by himself. It's only if someone feeds him, not talking at all, only staring and trembling of extremities. There was a history of one-sided love affair with the girl who got married before 3 to 4 months. But patient is in complete denial that she got married. Another incident happened before 3 months where patient started one online business, but he lost the entire invested amount. After that incident, patient started with low mood, decreased socialization, become less talkative, removed his hair and beard on the bed with the friend. We can identify major symptoms like low mood, poor socialization, foolish behavior, less talkative, followed by reduced psychomotor activity, mutism, negativism, trembling of extremities, poor self-care, total sleeplessness, and appetite loss. Sister said dispositionally patient is introvert and has anger issues. So after case formulation, I come to the diagnosis called catatonia in major depressive disorder. We have catatonic cluster of symptoms since 3 days, and in the background we have major depressive disorder symptom since 3 to 4 months. Homeopathic case processing was done based on the cardinal principle, and this is the repertorization result. So here we have 6 symptoms with elements from mental symptom, physical generals. So we have remedies like Ignatia, Natramur, Hyoscyamus, phosphoric acid, aurum, Nux vomica, sulfur, and lycoperdon. On the basis of above symptom complex, we have elements from love disappointed and business failure. We have characteristic symptoms like taciturn, staring, sleeplessness, appetite poor. So when we refer condensed materia medica by C. Herring, we have symptoms like absence of mind, joyless, indifferent, and taciturn. On the basis of this clear-cut elements from characteristic symptom and physical generals, I decided to go for Natramur 1M for this case. Why 1M? Because of high sensitivity at the mind level, good characteristic symptoms, clear elements from, and high similarity at the totality level. This selection was helped by core disposition of the patient, that is introvert and anger. So I started with Natramur 1M 6 hourly. After 1 week, patient started eating by its own, taking good care, self-care, selective mutism was present, staring was present, but sleep improved, that is 4 to 5 hours per day. According to father and sister, he is much better. But there was a symptom of catatonia, that is mutism and staring. So I increased the frequency from 6 hourly to 4 hourly. After 1 week of follow-up, speech improved, sleep is 6 hours, cooperative, well-dressed, maintaining eye contact, occasionally buried in thoughts, but much improved. So I decreased the frequency from 4th hourly to TDS, Natramur 1M. After 15 days of follow-up, there was no symptom of depression or catatonia at all. Sleep normal, mood normal, maintaining eye contact, patient started working regularly, socialization is good. He feels there is no need of medication. So I closed case with only 1 dose of Natramur 1M. From this case, we learn that catatonia is complex neuropsychiatric disorder which is likely to be significantly underdiagnosed due to difficulty in clinical examination, early recognition, and other comorbid medical and psychiatric conditions. Assessment by competent physician facilitates both, that is, improved diagnosis accuracy and more coordinated approach to the treatment. Delays in the treatment of this condition can result in poor response to the treatment and significantly increase morbidity and mortality rates among the affected patients. However, if recognized and handled in the early phase, with the help of homeopathic treatment, gentle and rapid clinical improvement can be achieved. Thank you. I hope you will like and learn from this case. Thank you.
From my heart, I pour it out to you. I am here to worship you. I have come